Well, hello and welcome to Rajat TV. You're watching India Fights Back with the host Rajat Kain. In this edition of the show, we'll discuss India's second phase of mass vaccination with Prime Minister Modi leading the way this morning, taking his first vaccine jab. The second phase of COVID-19 vaccination kicked off this morning with the target to cover people over 60 years of age and above. Well, as per the guidelines, even those above the age of 45 years who have illness will be eligible for receiving the coronavirus vaccine. Now, phase 2 of COVID-19 vaccination drive will aim to cover 10 crore people across the country. So far, little over 1.45 crore, which is a huge number if you compare the worldwide number of people being vaccinated, have received COVID-19 shots in India. Well, to discuss further on this issue, we joined with our guest, Dr. Madan Gopal, Senior Consultant, Health, NITI Aayog. Many thanks, Dr. Madan Gopal, for joining us. And Dr. Santasabuj, he is Scientist, ICMR, Kolkata. Many thanks for joining us. Let me start with you, Mr. Madan Gopal. Sir, now we are starting with the second phase of vaccine. For the benefit of our viewers, could you run down what this phase aims at? The category of people, the number of people, and the age group who will be the beneficiary in second phase?
Thank you, Rajat. Because the COVID vaccination is happening and the supply is limited, all the countries, they are going in a phase-wise manner to inoculate their population so that the effects of the pandemic and the pandemic response can be contained. Right. During the first phase, we have administered this vaccination to our healthcare workers, followed by our frontline workers. The vaccination started on January 16th and it is continuing. The frontline workers and the healthcare workers, they are getting inoculated, and around 120 million doses have been administered till now. That's one thing. After that, now in the second phase, we are taking on people more than 60 years of age and people who are 45 plus with comorbid conditions. So that kind of category of people have been taken. And today, being the first day of the second phase, our Honorable Prime Minister has taken his first shot of vaccination.
Right.
So COVID vaccine, COVID portal is also open now. You can register yourself, you can book a slot, or if you are not able to do that, you can walk into any of your nearest centers and utilize the services by registering there and get the vaccination done there. That kind of phase has started. After doing this, then we will be coming to the other populations as well.
Well, that's important. Dr. Madan Gopal, before I go off to Dr. Santasabuj Das, let's get a perspective here. In the first phase, in the initial days of first phase of vaccination, we saw there was a hesitancy, but now after Prime Minister Modi himself taking a first jab, so will that also aid in any sort of rumors or this hesitancy to dispel away once and for all?
Yes, obviously the hesitancy is not there. Initially, when I got my first jab on 30th of when it was offered to me, there was a lot of hesitancy during that time. Today, I would be going and getting my second vaccination dose done. So now things are picking up. The healthcare workers, we have covered 70% of the healthcare workers now. The frontline workers also, it has picked up, and the number is increasing day by day. And there are a lot of queries coming that where to get vaccinated. That means people are now enthused after looking the videos today in the morning news. I got a lot of calls. And I am getting saying that sir, certificate kaise banega, kya banega, that kind of queries are coming. That means some enthusiasm has been created. The hesitancy which was witnessed during the initial phase, as usually happens with the other vaccinations also, is now slowly and slowly phasing out. As the cases are also increasing now, people are now more or less coming towards the vaccination side. So hesitancy won't be there, not that much as of now. It won't be there.
Right. Many thanks for your opening remarks. Certainly, the second phase of vaccination hasn't started today. In the first phase, we saw initially there was some hesitation, but now as we're heading towards second phase, the hesitation slowly is going away. That's what Dr. Madan Gopal says. And of course, it's a big plus for us. Well, going off, let's broad basing this debate further. Dr. Santasabuj Das, sir, Now we have seen that India has rolled out a massive vaccination program. It's fairly gigantic. In terms of the number of people who've been vaccinated, this is the highest number. How forthcoming do you see the second phase would be, especially for people above 60 years of age? How important is this phase?
Okay, yeah. Good afternoon, Rajat. So you are very right that we were a lot of people were apprehensive that whether we'll be able to, because we are known for our vaccine production capacity, but vaccine distribution capacity and actual vaccination capacity, we were not even sure that whether we are going to be able to take up this huge task. And what is achieved is more than what is expected. It has been done really smoothly. This huge vaccination drive, and a lot of countries, advanced countries, have actually failed compared to this. What we have achieved in this more than little, it's just 1.5 months. So I think that has created a lot of hope, expectation that we'll be certainly be able to gear up, because the first phase was 3 crore was the target population. Now in the second phase, as Dr. Madan Gopal said, that 10 crore is the target population. And again, this target population, so the first phase target population were already, they are in the healthcare system, or, they are out in the job. Now, we are going to a population who are, a lot of them are home confined and, have various diseases. So it's a more challenging task. But I'm sure that, with our experience with the first dose, good experience, positive experience, we will certainly, certain reason to believe that we'll succeed in the second phase. There are some challenges, as I just mentioned, 1 or 2, and again, like these, a lot of these people, maybe there are not enough people to take care of them. So how would they actually get the vaccine is another challenge. So these are additional challenges, I think. I mean, hesitancy part would, as Dr. Madan Gopal said, that is slowly, going off. But for this population who are, aged, this may come back again for few, particularly those who have some comorbidities, serious comorbidities. And certainly, Prime Minister coming forward would certainly, create confidence in them, in their mind. And another good thing that government has initiated is to rope in the private institutions. So almost 10,000 private organizations have been roped in, who will distribute the vaccine. I mean, we will vaccinate people at a maximum cost of 250 rupees plus for perhaps 100 rupees additional cost. So this is I think would be a good initiative, and is the right initiative, because if we had to depend only on the healthcare, government healthcare system, it would have been, it would be overstretched, particularly when the cases are increasing. So, then this system will have to be dealing with more active corona cases. So I think that roping in private institutions is a good, right step. And sealing the price is another, was very important to avoid any overcharging on people. So, I personally am very confident that we'll again set an example to the world, to how to vaccinate this high-risk population in a short time, in a large number of population.
Right.
That's
certainly. Yeah, certainly. So more and more people should get vaccinated. Dr. Madan Gopal, as you know, in this show, we keep suggesting our viewers that please follow experts. Do not take any other advice. So as an expert, sir, which group with certain comorbidities you would recommend, you would suggest, you would request to get vaccinated? Could you list down major comorbidities, the ones who should certainly go for vaccination now?
One is, it's a very right question. If you look at the Kain app and the Kain portal, the morbid conditions are already given. There are 10-15 morbid conditions which have been listed out. So they have to follow that morbidity. Let me read it out, that morbid conditions.
Certainly, sir. Yeah.
One is the person is to be One is that the comorbid conditions have been evolved after a discussion with the experts over a period of time. One of the condition is a heart failure with hospital admission in the past 1 year.
Okay.
If any person is having that kind of condition, he is eligible for taking this jab if he is 45 years and 45 to 60 years of age. Above 60 years of age, it's free for all. Anybody can walk in, get registered, and then. But person with comorbid means if they are 45 years or less than that, if they are having a heart failure with a hospital admission in the last 1 year, then the post cardiac transplant, left ventricular assist devices, the person having left ventricular systolic dysfunction, moderate or severe valvular heart disease, congenital heart disease,
Okay.
then coronary heart disease, angina and hypertension, diabetes. That means if the person is having hypertension and diabetes, along with that he is having angina, then he is eligible for taking this vaccination. Then the documented stroke with hypertension and diabetes, and people who are on hypertension and diabetes of more than 10 years with or without complication, they are eligible to get this vaccine jab. Then the kidney and liver hematopoietic cell transplant recipient who are on wait list, then end stage kidney disease, current or prolonged use of oral corticosteroids, decompressed cirrhosis. These are conditions which are listed out. And anybody who is falling into this category, they have to get a doctor's certificate. And when they are applying for a slot in the vaccination appointment, they have to see that the doctor certificate specifies this condition and they become eligible after that. So these are the conditions which are listed out in the COVID portal and the doctor's certificate which are there, and he has to just write yes or no, and that certificate has been issued. After issuance of the certificate, he has to upload that, or he has to bring that certificate in the hard copy to the vaccination site wherever he want to go and take the vaccination shot. This is the process which is very simplified. As the vaccination drive process and the people get more comfortable with the things, I think it will pick up. It just pick up slowly.
Absolutely, sir. We also hope that it picks up, and certainly this phase is important, as Dr. Madan Gopal just listed out. People having certain comorbidities, people above age of 16, 65, so certainly they should be encouraged to go and get vaccinated. Dr. Das, as we have broadened our logistics in this particular phase with the involvement of private sector, all the private sector was involved earlier as well, perhaps in a limited capacity, but now we'll be having vaccination at the private hospitals. So would it require training of extra officials, extra staff of the private hospitals? How is the private sector gearing up for it?
I think, of course, I mean, they will require staff at private hospitals, perhaps would require some training about, particularly, like the one that the government hospital system followed in the first phase, like, after the jab, people were asked to wait for half an hour on site to see any adverse reactions coming up. And then when they are released, they were told that, if there is any adverse events, in case of any adverse events, they need to contact directly and then the number was provided, particularly the nurse who administered the vaccine and also hospital number. So and the adverse events that could happen, particularly allergic reactions, if there are any, so that has to be monitored. And so I think some kind of, it's not a very sophisticated training, but because, people working in hospitals, they have experience, whatever hospital, they have experience giving vaccination. Okay, I mean, to kids, to elderly people, like pneumonia vaccination, or, for pneumonia or for influenza, people are experienced with that. So this is not a very special type of thing. So the vaccination per se perhaps will not require much of a training. But what would be required is to, because this is, as we all know, that these vaccines are to some extent, considering the pandemic, prematurely launched. So that then there are concerns about, if there is any side effects. Although we know after this big number of people being vaccinated, there are very, very few serious side effects. Very, very few. Extremely rare. So they are very safe vaccines. Still, I would suggest that that maybe staff from the government hospitals where vaccination has already happened, they may be contacted to train the private hospital facilities who desires to get trained. That they
That's
feel that
important.
they need
Yeah.
some kind of
Right.
they may contact the local private hospital, government hospital,
Government
or
hospitals.
setup
Right,
to
right.
get
Just
some.
stay on, Dr. Das. Let me just ask Dr. Madan Gopal about it. Dr. Gopal, do you also agree that in a private hospitals, if there is a requirement of training the staff, they should contact government hospitals as their experience has been pretty vast in dealing with the vaccination? Or you are seeing that private hospitals are totally geared up for rolling out vaccine?
It's a very interesting question. What has happened is that if some private hospital, if they want to register as a vaccination site, during that time itself, the capacities of the hospitals are assessed, and the people who would be doing the vaccination, they would be provided training from the government side.
Okay,
And
okay.
unless they are having this kind of requisite staff, they can't become a vaccination site. That's the primary requirement. But secondly, if they want to ramp up another thing, they are free to bring, because that's why a provision of 100 rupees for services and 150 rupees for vaccination that has been kept it there. So they can always ramp it, but if they have hired somebody to do the vaccination, unless they are trained, they are not allowed to act as vaccination site. That's a part of the operational guidelines which are very clear.
Right, right. Dr. Das, like since in this show we're discussing all about phase 2 vaccine, and this will see a lot of people from age group of 60 plus, 65 plus. What are the side effects one should look out for? I mean, if at all it develops.
So as such, the side effects perhaps would not depend much on the age of the population
Okay.
or their comorbidities. Okay, I mean medical term called hypersensitivity to the antigens. That would happen, in at all age groups. That could happen at any age group, depending on the background of the person. So if somebody has a history of hypersensitivity to a vaccine, another vaccine, or are prone to multiple allergies to multiple agents, then they may be, they may need to be careful if there is anything coming up. Otherwise, age or associated comorbidities are not a risk per se, a higher risk for vaccination to this particular vaccine. In
Certainly.
fact,
So
those who have higher risk,
please go on. Yeah, please go on. Yeah, you're adding on something.
in fact, those who have, just Dr. Madan Gopal has enumerated the conditions. So basically, those who have serious comorbidities, which could endanger their life if they are infected with COVID-19, they are the prioritized group who should be vaccinated first. Okay, so like those who have transplants, those who have end-stage kidney disease or serious heart ailments, those are the people who are the priority groups. So they should come forward, and they should be rest assured that this vaccine, so far whatever vaccine has been, there's two vaccines, Covishield and Covaxin, that has been given in Indian scenario. Both of them came out to be very safe, and there is no need to be worried for this elderly population or population with comorbidities for any serious side effects just because of their ailments or age. And whatever, for side remain very few, and that is expected to remain few with this age group also.
Dr. Madan Gopal, I know this show is all about phase 2 vaccination drive starting today. If you just look back at phase 1, how satisfied you would be as somebody who has been involved in first controlling the pandemic and now getting towards, at least in a bit, to get over this pandemic? I know it's still a far way, but how satisfied you are with the first phase of vaccination drive?
Uh, it's very fascinating because we never thought that 6 months down the line we would be actually doing the vaccination.
Okay.
So that's the thing which I can only express. Last March and April, we never thought that the vaccine would be so quickly available, and we would be able to quickly roll out and cover 120 million population. It's very, very fascinating. Apart from that, once it comes to the general population, now the private sector getting involved, vaccine slowly and slowly getting freely available to all the people. That gives quite contentment. That saying that yes, now we are moving towards the right direction. Had it been also complemented with the COVID appropriate behavior, which is somewhat lagging, then we would be in a very, very satisfying position as of today. But at some places that appropriate behavior is missing, and people who were positive, they have attended marriage parties and they acted as super spreaders. And because whatever infection is happening, it is because of super spreading events only now. And super spreading events having now, with the vaccination coming in, at least the people who want to venture out and there's at least some confidence would be there. And it gives a lot of satisfaction the way things are moving.
Are you slightly wary of these numbers coming up? I mean, I know it's again seesawing, as we discussed last week. There are some weeks where numbers go on a little higher trajectory, then it comes down, and then now it goes up by 1% to 2% comparing the previous day. So is this still a cause of worry as an administrator for you?
Even a single case is of worry, because if you look at the active cases in the previous discussion also, I mentioned when the cases are coming down. But if you look at the active cases who are potential for transmitting the infection further, if you look at the active cases loads are very high. The districts, you would be having a lot of districts with more than 1,000 active cases. That is the situation as of today. In Maharashtra, I think around 10 districts who are having more than 1,000 cases. In Kerala, most of the districts, they are having many active cases. Active cases means they are the reservoir of infection and they can be potentially transmitting. And how important is how our containment and the contact tracing and the basics of epidemic management are in place. If we don't stick to the basics, then this is a time that if you don't stick to the basic, then you will have this kind of events which we have witnessed in the district of Amravati and that interiors of Maharashtra.
Right.
When the numbers are increasing, yes, please.
Yeah, Dr. Das, you also agree that these numbers were rising, even though, or albeit in a small percentage, still happens to be a cause of worry, and there is something like we have to really enforce the COVID appropriate behavior among people. There is no place to get complacent at this stage, at least.
Exactly, I fully agree with that notion. That because we must understand that we are not out of the pandemic yet. We are very much in the pandemic, and we never know when the cases would, like the way it started increasing. I mean, whether it's a second wave, people are discussing or debating whether it's a second wave or not. It's first wave, it's still going on. But more important is that we are in the midst of the pandemic, so cases can go up anytime if we just come out, or if we become complacent about the COVID appropriate behavior and take risks, and that exactly what is happening. And this was kind of to some extent apprehended also before vaccination drive was launched, because there was some apprehension. Then once the people gets vaccinated, starts getting vaccinated, so they will become complacent, that we are no more at risk, particularly after one dose, when there is no real protection, but still they may believe that we are protected. So they will take off the guard. That risk was always there. So we must insist upon people that there is no such scope. And then again, on the other hand, you cannot just keep on saying that even if you are vaccinated, you are still equally at risk with the unvaccinated population. That can maybe a discouraging thing. So I mean, but we should give them the right perspective. Okay, the important thing is that vaccine may not protect them to get infected. It will certainly reduce the severity of the disease, but if they carry the virus, they may spread it to others.
Right.
Even though they do not suffer, the others who are more susceptible, particularly those aged people at home with comorbidities, they will suffer severe disease. So they must be, made to understand that for the sake of others also, as well as for the sake of themselves, because they may also need to tell that the virus changes its character,
Right.
which it is doing. So even if you are vaccinated, but there's some form of disease, although maybe mild, but disease may still happen. So continue COVID appropriate behavior. Get confident that it's good that you are vaccinated, so you are emboldened with some ammunition against the virus. But
Right, Dr.
for the
Das.
sake of the larger society,
Right.
do continue with your COVID appropriate behavior. That should be the message we should give.
Dr. Das, we have to leave it there. And of course, many thanks to both the experts, Dr. Madan Gopal and Dr. Santasabuj Das, for, of course, bringing to light what all needs to be done, or what is all about the phase 2 of vaccination. At the same time, as both our experts are saying, no point, or at least to say there is no place to get complacent. Please maintain COVID appropriate behavior, and this is what our appeal to our viewers as well. Well, keep maintaining COVID appropriate behavior, keep washing your hands, keep maintaining physical distancing, and please keep wearing masks. That's it in this edition of India Fights Back. Thank you. Goodbye.